located in low-income countries, but even in middle-income or high-economy countries such as India, because of the disparities, because of the complexities within the country. So the State of the World Population Report, which is being launched today by UNFPA, WHO, and the International Confederation of Midwives, otherwise known as ICM, presents very compelling evidence for investments both in additional midwives and in the quality of existing ones. Dr. Punita already pointed out to very specific numbers of lives that could be saved, but I'll repeat them just to remind us. She said in the report, pointing the report, that more than 4 million women and newborns could be saved if we had sufficient midwives. Just think about that. If that woman or newborn was someone related to you, close to you. I mean, sometimes we speak of numbers, but it is when we see a face, when we remember the faces of the women in line for maternal child care. Would anyone want to wish or remember that face and to next day hear that she's passed? No. That is why we're all committed to really making sure that this midwifery is a reality, but a reality with quality. The report also, as Dr. Punima said, points out to very, very specific areas of investment. There are many things that can be done, but the report sort of crystallizes 4 areas. I will not elongate much on those, but I will just repeat the theme, the critical titles of the areas for sake of remembering. Health investments, number 1, in the health force work planning, management, and work environment. And I will stress on the work environment. It's not enough to have midwives. Are they respected by their colleagues? Are they respected by their doctors with whom they work? Do hospital management give them space, stigma-free, gender-related stigma? Because usually, not only, but usually, midwives are women. Are they free from violence in the workplace or discrimination? Are they given the space to do what they're trained to do? Second priority, high quality education and training. It doesn't matter how many midwives we have in health facilities. If the foundational base of their training has not been good and the follow-up refresher courses is not followed, then surely nobody can give what they don't have. So let us invest in their training. Number 3, midwife-led improvements to health service delivery. Health facilities are being encouraged to have and to establish midwife-led models of care with expanded roles for midwives. There is no need for competitions. Midwives are not taking away the role of the doctor. The doctor, as I said before, needs to reserve his high-level training and the amount of time that he has been training, or she or he has been trained, to address critical emergency needs. Let the midwives do the rest. Number 4, invest in the midwives' health professional leadership and governance, including health policies and service delivery. Involve them. They must be part of devising those policies, because you cannot do for somebody better what they could themselves know, being in their shoes. Midwives are an invaluable resource, we all agree, and our health systems are critically dependent on them. Investing in empowered midwives is one of the surest ways to safeguard life and protect the health and well-being of all. As we move towards 2030, that sustainable goal agenda of achieving, as UNFPA has put it even more boldly, achieving 0 preventable maternal deaths and 0 unmet need for family planning, will need the role of the midwife to be improved and empowered. Now, what is UNFPA doing, you would ask? The UN Population Fund, which I lead here in India and in Bhutan, supports the Ministry of Health and Family Welfare in its decision to strengthen the role of the midwives. We are squarely with you. We partner with the Indian Nursing Council in terms of preparations to strengthen the training capacity of national institutions. We are taking directly to national training midwifery institutions because you have JPIGO, you have UNICEF and WHO who are also partnering with the ministry and taken other training institutions selected by the ministry as the initial ones. At the same time, UNFPA seeks to strengthen the skills of midwives, of the existing cadre of nurse midwives, because even though we want to create a standalone cadre of midwives, we should not disregard the nurse midwives whom we already have. They are playing a very important role. We have to ensure that the quality of maternal health services at primary care level facilities where the nurse midwives are, those facilities, the primary health care level, are closer to people's homes. Most of the deaths will occur because of that second delay. Which one is the second delay? The delay to get the proper help. First is identifying the emergency at the community level, but then once they have identified, how much time does it take for a woman to get that help, support that she needs, that care? So the primary healthcare facilities are pivotal. And even while we train midwives, the nurse midwives continue to be on our radar. This becomes important even now, especially during the situation of COVID-19, where tertiary and secondary facilities are extremely busy providing life-saving support to COVID patients. Now we at UNFPA, to conclude, are with you in these difficult times. We look with hope and anticipation to working together to establish and empower this new cadre of midwives, to strengthen the existing nurse midwives, because midwives are the backbone of a people-centered healthcare system. I thank you, and I wish you and all of us a happy day of the midwife, even as we continue to send our prayers and thoughts to those who struggle with COVID. Thank you.
Thank you, Dr. Argentina. It's a great hearing from you today. We have learned not only on investing in midwife, but we need also to plan and manage and also the working environment. I mean, that's a key message from your side. Thank you so much. And with your help, we could train around 1,900 teachers. We have built their capacity in the midwifery, and they are very happy. And also around 13 plus 8, 21 people have been trained in the simulation in the midwifery. So thank you so much for supporting us in capacity building of midwifery in India. Thank you very much, ma'am. Now we have the next speaker we have is Dr. Bulbul Sood. Dr. Bulbul Sood is a country director. JPIGO is a public health professional with more than 40 years of experience. Dr. Sood has been JPIGO's India country director since 2009. She is a respected figure in the public health field, known for her experience in international health and development, and has effectively demonstrated her ability to take programs forward in a holistic manner. Dr. Sood has strong technical expertise in reproductive health, extensive program management experience, and is well known in the fields of family planning, maternal health, and reproductive health, both in India and internationally. She also has demonstrated skills in advocacy, negotiation, and diplomacy. Now, I request Dr. Bulbul Sood to address the participants.
Thank you very much, Bharti. I'll just share my presentation. Yeah, Bharti, can you see it?
Yes, ma'am.
Okay. So, good morning, everyone. My fellow panelists, the almost 2,500 participants who have joined this webinar. And I don't have words to express thanks to everyone who is working in the field during this difficult times and have been working tirelessly for more than a year. Kudos to each one of the frontline workers, our community health officers, ANMs, nurses, doctors, lab technicians. I know we are going through a very difficult time, but I'm sure together we will overcome this difficult period also. And on behalf of my entire team of Jepaigo, and especially my fellow nursing professionals, who we have almost 70 in Jepaigo, I would like to thank everyone for giving us this opportunity and sharing, what is we, all are planning to do. This work is all in partnership with the national government, Ministry of Health, the state government, with INC, with WHO, UNFPA, UNICEF, and not to miss the SWAMI, and also the donors like BMGF, USAID, and others. My previous speakers have already shared why, the theme of this year is very important: follow the data, invest in midwives. And I think it's a time for all of you who are listening to us to use this data to do the advocacy. Each one of you are an advocate. Each one of you are the ones who are going to be making the difference. And what you have heard being spoken by Dr. Punita and Argentina, and also others who will be saying, please use this as a tool to, talk to your policymakers, to talk to your facility level other colleagues, to say why it is very important to invest in midwives. And today, of course, we all congratulate also on the release of the State of Birth Midwifery report, which has really brought out the importance of investing in midwives. And we also know that in terms of return of investment, this is going to really pay dividends. Now, what is midwifery? Everyone keeps talking about this, and I think there is something that we need to be definitely talking about, that midwifery is much more than just catching babies. Okay, midwives is about supporting the physiological birthing. Midwifery is about supporting women and families. And midwives can be supported by all members of the team. So it is a team approach, and we've heard earlier, it's the entire team of the doctors, OBGYN, nurses, and other staff, which is going to be the one which will be able to, if we work together, we would be able to achieve the goal of saving lives, improving health, and transforming future for millions of women in the time to come. What does data show? And previous speakers have definitely shared why we have to invest in midwifery in terms of reducing the maternal deaths in the newborn and stillbirth also. So this is an important tool, and I again urge each one of you to use this data to keep talking about it, why we have to invest in midwifery. And of course, if we do that, we will be able to save lives of almost more than 4.3 million by 2035. I also would want to say that when we are investing in midwives, we are actually investing in women, both from the point of view of the providers, and since midwives, most of them, in fact, I think 99% are women, and also investing in women from the point of view of the client. So investment in midwives is I won't be wrong to say it is almost investing in women's cause. And so we need to, again, urge our policymakers, the governments, the international donors that this is something which we at this moment is very critical, and we need to, keep this pressure to say continue investment. And it's not investment for a year or so, but it has to be a continued investment that we have to focus on. Again, previous speakers have said that 90% of the essential sexual, reproductive, maternal, newborn, and adolescent healthcare can be provided by midwives. And again, COVID time has definitely demonstrated how we have to, do the triaging, and then what needs to go at the higher level and what care can be provided by, a provider of different level has shown that effectively we can, save lives and improve health. Again, Cochrane data review showed that, again, midwifery-led continuity model versus a model of care for childbearing have shown that midwifery-led care can result in 24% reduction in the preterm birth and significant reduction in, things like episiotomy or instrumental birth, or even use of the pain relief drugs. And again, Lancet Series 2014 showed that 87% of the maternal health services can be provided by midwives when educated to international standards. And I'm so happy to see that India is really moving in that direction. And, we soon should have a team of trained midwives to that standard. Now, I don't have to go this, that everybody knows that in India, we have made tremendous progress since 1990. And if you see, the MMR reduction in India compared to global MMR reduction has been significant. We have had, institutional delivery rates going up in the country. There are states where almost 90% of deliveries are being conducted in the institutions. And we are on the track of MMR, which is currently 113, and we should be able to achieve the SDG goals. However, there are still problems. There is lack of quality care, and especially when we say lack of respectful women-centered care, and RMC is not part of the current medical nursing curriculum, and gradually now that is being introduced, and we're talking about that women also need respect at this time. And we have to make this experience a good experience for the women. Again, there is inequality, about between urban and rural. And again, that needs to be, we need to work together to see that this divide is decreased. Lack of skilled HR, again, especially for intrapartum care, is a challenge in India. And the data shows that only 34% of OBGYNs are in the CSCs, and there is also lack of pediatrician. And the other problem, of course, your problem is that low institutional delivery rates still continue in some states. And then, of course, the over-medicalization of births, especially with the rising C-section rates in several, especially urban areas. So we all know that India took this, I would say, decision to launch the midwifery program. And this was launched in 2018 at the Partner Forum. And since then, Government of India has continuously been working with all the partners, and today we are in the process of creating the national and state level midwifery training institutes, and also MLCs and other. Unfortunately, because of the COVID, things have slowed down, but I'm hoping that soon, once this pandemic is on a downhill track, we would be able to restart some of the activities which were planned earlier and were delayed. What will change through midwifery-led care units in India. And again, you are all going to be the advocates. So I want all of you to know that once we have the midwifery-led care units established, we will able to talk about promotion of physiological birthing through a positive childbirthing experience, early identification of the complication, and management and timely referral through the collaboration between the OBGYN, nurses, doctors, and everyone, decongestion of the high-level healthcare facilities, and not last but the least, expansion of access to quality MNH services in remote areas and urban slums. As Japago, I'm very proud that, we have, as I said, a very strong nursing force, and we've been working collaboratively with all the key stakeholders, Indian Nursing Council, our advocacy partners is the White Ribbon Alliance of India, development partners like WHO, UNICEF, UNFPA, and the donors, Gates and USAID and others, and state governments of various states that we are all working, SOMI, TNAI, and of course, most important, the Ministry of Health and Family Welfare at this national level and state level. And I'm confident that together, all of us, when so many, dedicated people with intention of changing and making this world better, we would be able to achieve all that we have set out to. At the end, I would just want to thank each one of you for joining in this webinar, and also thank the organizers for organizing today's webinar on a day which is very important for all of us, International Midwifery Day. And again, please take care. Please follow all the appropriate COVID behavior. Get yourself vaccinated. That is the one which is going to save us and all. And please keep safe. Thank you very much.
Thank you so much, Dr. Bulbul Sood, for your remarks on the midwives. As you said, 87% services can be delivered by midwives educated at international standards. And midwife-led care units, which is around 86,000 to be established by the government of India, can address maternal and neonatal mortality and morbidity by promoting quality and continuity of care through provision of human-centric care and promoting natural deaths. I think with the help of Minister of Health and Family Welfare, with JPIGO, UNFPA, and other stakeholders, Indian Nursing Council has developed nurse practitioner in midwifery. I think you all would have seen it's gazetted and it's available on the Indian Nursing Council website. I think you all are welcome who have the passion to become a midwife and to lead a unit. You please come forward and take admission to these programs. Thank you very much, ma'am. Now we have Dr. T. Dilip Kumar, President, Indian Nursing Council, ex-nursing advisor for Government of India, ex-project director, GF18 program. He has a long-standing 43 years of experience in nursing in different capacities, starting from staff nurse and to advisor to Government of India, and he's also President of Indian Nursing Council. We welcome you, sir, and invite you to please address the participants. Madam,
good morning to all of you.
Sorry, sir, Madam Dr. Bulbul, sir, can you please stop the sharing of the screen?
Is it finished?
Yes, ma'am. You have to stop the share screen. Yeah, thank you, ma'am. Yes, sir.
Good morning to all of you. Greetings from the Indian Nursing Council on the International Midwives Day. In the middle of the COVID-19 surge, our nursing and midwifery professionals are extremely and outstandingly taking care of the treatment, care and support we have to congratulate our nursing and midwifery professionals in this difficult time. They have shown their commitment. They have not shied away, knowingly very well they are going to get infected. In spite of that, even after they getting infected, taking the treatment, they are coming back to serve our community. That itself shows the ethics and the oath which the nursing and midwifery professionals, which we take during the initial period of the training, that immensely they have demonstrated in action in this difficult pandemic period. I think the 5th May, globally we celebrate International Midwives Day, and the theme is already has been well laid out. And for me, the theme means for the International Midwives Day is 2 words: data, investment. These are the 2 words. And these 2 words, I think we are hearing for the last almost 2020, International Year of the Nurse and Midwife, the WHO and the ICN has, to commemorate the 200-year birth anniversary of the Florence Nightingale, the WHO for the first time, they have declared 2020 as the International Year of the Nurse and Midwife. And also they have released the SON report, State of the World Nursing Report. If you see the theme of that SON report, there are major 3 themes are there. The one is investment. The second is investment in nursing education and investment in creation of the positions. And the third theme is leadership. So these 3 components of the International Year of the Nurse, this one report is definitely applies to the midwives also. Because since my experience working in the Government of India and also working as a president of the Indian Nursing Council, we can come out with any number of the specialized courses by developing the syllabus and regulations for the implementation. Until unless the posts are not created, I think I am making this point very clearly, because my experience shows that this is the part which we don't get much support from the organization for creating the posts. So therefore, this theme of the investment is very clear, and also more to this whole whatever the data and the investment for this International Midwives Day, more appropriate, more relevant to India. The reason why I am telling is, as I said earlier, we are not getting much support for the creation of the positions. In this perspective, we have to congratulate the Government of India for making a commitment, because I am telling you, you can, even while working in the Government of India and the Ministry of Health, my experience shows that you can conceptualize the concepts. But until unless there is a commitment on the part of the investment, that investment not in the words, the investment should be in the form of the money. So that is a very important thing which we are seeing in this midwives. The Government of India was able to commit themselves that they are going to develop, train and place them 86,000 nurse practitioner midwives. So this is a commitment. This is an investment which has come, which is way more relevant to this today's theme. So where the Government of India National Health Mission has made a commitment, yes, we are going to establish national and state level midwifery training institutions, whatever the expenditure which are there, because since my experience tells, making a statement until unless you don't commit for the in terms of the money and the policy guideline. So that has been shown by the Government of India, by the National Health Mission, that they are going to establish the national and state level midwifery training institutions, and also the creation of 86,000 nurse practitioner midwives. So this is a big commitment, which is very relevant to the investment, what this today's theme is telling. Coming to the data, I think data is one of the things which very important for you to take the policy decisions. And at least for the sake of the Indian Nursing Council, I can tell you, because the day one we were worrying about the data for the effective manpower planning. You need a data. You don't have a reliable data about the effective nursing and midwifery profession data. So in that perspective, I think Bharti is going to share with you about the type of the concept and the policy decision Indian Nursing Council took was the establishment of the nursing registration tracking system. As on today, I am talking about 1 million nurses, midwives. We have a data linked with the Aadhaar number. So this is the data which we have now at least creating, and this is more relevant to the international nurses midwives the theme about data. So therefore, the lot of thing has been told that, and our commitment on the part of the Indian Nursing Council that to ensure that a qualitative midwifery training, and for that during this COVID situation, we were able to collaborate with the UNFPA to capacity building of the midwifery teachers, which we are able to do it, and rightly at least know the in collaboration with the JPAGO and the Lateral and the Indian Nursing Council and SGT University, we have established a state-of-the-world simulation center in Gurgaon. So this simulation center is going to be used for the qualitative the standardization of the procedures, and also the midwifery teachers are brought to this place for an effective qualitative competency-based training program. Not only for this midwifery, we are going to taken a policy decision that the new BSc nursing curriculum which is going to come up will be having a linking with the simulation competency-based training program, the new syllabus which you have already laid out. So in that perspective, the data and investment, which is very important for this today's theme, and we Indian Nursing Council, we are taking forward the Government of India's initiative of developing the nurse practitioner midwifery curriculum and also midwifery educator curriculum, and ensuring that capacity building of the teachers are going to make a lot of impact in the quality and also the placement in the rural area in the country. So in that perspective, and we have also taken along with the JPAGO, we have taken initially how to improve the pre-service education program, and especially in the pre-service education program, we partnered with the JPAGO, and whatever the concept we developed between the Indian Nursing Council and the JPAGO, ultimately the Government of India took our initiative, and now they have made a pan-India program. That's how our Assistant Commissioner, Dr. Padmini, was making a mention that they have made a lot of investment in capacity building of the many of the nursing schools and colleges of nursing in terms of the providing the skill labs and also training the faculty in the midwifery training program. So in this perspective, UNFPA, Dr. Argentina was making a mention that continuing education is very important, and also therefore we are supporting that each state should have a center of excellence, and that center of excellence should have a Department of Continuing Education program for nursing and midwifery professionals, and they should be brought to the periodic continuing education program. In that perspective, I think investment is not taking place. I think we have an army of the nursing and midwifery professionals need to be given a continuing education. So therefore, there is a need to have an investment. Similarly, the leadership. I think until unless if we don't have a good nursing organization at the national level and also at the state level, whatever the planning process which we do at the national level, it is not going to make an impact in the implementation. I think if you see the way back, the then Prasanna Kumar Hota, the then Health Secretary, wrote a letter to all the state governments. A nursing organization need to be strengthened from the national level to the sub-center level. I think that needs to be translated into action. If at all, if you have to take this midwifery initiatives, which has been launched by the Government of India, to put it in a proper place and effectively planning, and also to ensure that the qualitative process is in the training and also in the placement and also in the supervision, we need a good nursing and midwifery organization, which is very weak now at present. So therefore, we have to, all the partners have to work together to see that the Government of India's and Indian Nursing Council initiatives for training and placement to make it successful, and which will be in tune with the today's International Midwives Day. So we have to work together to see that this program of the Government of India's initiatives to make it successful. Once again, I would like to greet all the nursing and midwifery professionals who are working day in and out in this COVID-19, and even with this time, efforts are being made not to disrupt the essential maternal child services and also immunization program. So we have to salute the auxiliary nurse midwives, ASHAs workers, all the frontline workers working in the healthcare delivery system. Once again, I wish you best of luck. Thank you very much.
Thank you very much, sir. Thank you very much for your kind remarks to the participants. Now we have Dr. Roy K. George, who is the president of TNAI, will be the next speaker, and is one of the senior most professor in psychiatric nursing in Kerala with 19 years of collegiate teaching experience in UG and PG. He is also a chief editor for Kerala Nursing Forum, first journal of nursing from Kerala. He's a researcher with special interest in dementia and old age. Many publications in national and international journals he has on his strike. So as he's very busy, he's not able to attend now. So we are having his video recorded message.
Greetings from the Trained Nurse Association on the occasion of International Midwives Day. Actually, nursing and midwifery are two professions which constitutes the largest group in healthcare sector. And midwifery is the basic care, maternal care, which have been in existence since time of human life in this field. But professional midwifery has developed along with nursing or much before nursing, and has been contributing to the health of women, children, and total humanity since centuries. In many places in the world now, nursing and midwifery coexist, or in some places they consider midwifery as part of nursing profession. But in modern context, well, with the changing trends, in a country like India, we need to promote midwifery as an independent profession. Celebrations like International Midwifery Day reinforces the need to make independent midwifery practice more popular and more wide-reaching. An independent midwifery practice is definitely essential to promote safer deliveries and rather more safer normal deliveries. Hence, as it is said by statutory body like Indian Nursing Council, nursing practitioner in midwifery is being promoted. We need to establish it every part of the country to meet the needs of the population, especially the women population and children in this country. Current year's theme of the International Midwifery Day is very apt to promote midwifery because it proclaims or declares the need for investment in midwifery, invest in midwifery, with generating more data. And it coincides with the release of World Midwifery Report. Last year we had the World Nursing Report, and this year we are going for the World Midwifery Report, which is compiled by WHO, UNFP, and ICM. All this will definitely contribute to establishment of midwifery as a more assertive profession, and will help public and the health sector to identify the importance of midwifery practice in ensuring healthier generations to come. So on behalf of Trained Nurse Association of India, I salute all the midwives around the world, especially in India, and wish you all the best in your future career. And let us look forward to the dawn when nursing, independent midwifery practice becomes the norm of the day. Thank you very much and all the best. Thank you.
Now I request Madam Mithali Adhikari, the President of SOMI, and she's Professor in Government College of Nursing, Bardhaman, West Bengal. Madam, please address the participants.
Thank you, Madam Bharti, for giving this opportunity. I would like to deliver my thanks to INC, in the Nursing Council, Dr. Dilip Kumar, President, and UNFPA, Japaigo, for arranging this type of that session or the meeting. So happy International Midwives Day to each and everybody. It is needless to say, or it is the echo of the all speaker, that it is the right of the woman to receive individualized, skilled, sensitive, safe, respectful, compassionate care during antenatal, internatal, and postnatal period. Midwives means with the woman. It is the partnership between the women and the midwives are the key person and the backbone of the healthcare delivery system to provide women-centered, respectful care during the pregnancy, childbirth, and later on through continuum of care. SOMI, in partnership with WRI, UNICEF, has actively involved in many activities for quality improvement of sexual, reproductive, maternal, newborn, and child health, ending preventable maternal and newborn death, and achieving SDG. SOMI also participated activities related to improvement of the maternal and neonatal health through advocacy, implementation of LAKSA, capacity building program among the nurse midwife who are working in the maternity field. SOMI WRAI is continuing advocacy on creating an enabling environment for the initiation of NPM and creating the post of the NPM in different states of the India with the help of the INC, Government of India, and other stakeholders. Based on the report of the SOMI, the theme of the International Day of Midwives is selected in the year of the 2021. Follow the data, invest in midwives. I'll not mention anything because it is already mentioned by Dr. Punita, and others also. Data shows that there is an acute shortage of midwives all over the world to render effective and efficient care to women, mothers, and their babies. SOMI, the Society of Midwives India, urges to WHO, Ministry of Health and Family Welfare, state government, Indian Nursing Council, Trade Nurses Association of India, FOGSI, WRAI, UNICEF, UNFPA, Japaigo, Maternity Foundation, those who are working with the mother and the newborn and the child, and other stakeholders for investment of quality midwifery care throughout the country to save the life of mothers and their babies. Society of Midwives India applauds the contribution of nurse midwives, ANM, ASHA, doctors, and other healthcare providers who continue to render uninterrupted services for mothers, babies, and the public during the critical and stressful situation of COVID-19 pandemic throughout the year. I salute all nurse midwives for their commitment in this grave emergency situation. I request all the healthcare providers to maintain COVID-associated behavior to save their own lives also. Thank you so much.
Thank you, ma'am, so much for your wonderful message to the midwives. Thank you so much. And now we have next speaker is Dr. Tarun Soda. He's a public health professional with over 10 years of public health experience. Currently, he's working as a country director in an international NGO, that is Maternity Foundation. He's working towards empowerment of skilled birth attendant and midwives through one of their digital solution, that is Safe Delivery app. I think many would have have worked into, especially in the virtual capacity building. I think Pearl always says to go through this safe app delivery. So now over to Dr. Tarun Singh for your message to our midwives.
Thank you so much, Bharti ma'am, for the introduction, and a very good afternoon, and congratulations to all the esteemed speakers and audience on International Day of Midwife. First of all, I salute all the healthcare workers who are providing services in the field right now in this pandemic and in this situation of the crisis. So our salute and our wishes to them. As mentioned by most of the speaker, I am very proud and happy that India has made significant progress in improving maternal health in last few years, and has progressed towards achieving the Millennium Development Goal for the maternal mortality ratio, which is the only indicator we have achieved for the Millennium Development Goals. And this was achieved by a lot of programs which was launched by the government of India, INC, and supported by the partners like Lakshya program, Dakshita, Daksh pre-service education program, which basically focus on the improving the quality of care. And recently a shift has happened through the Lakshya program and Dakshita program on the respectful maternity care, which was missing in earlier programs before 2014-15. So I guess we are moving towards the midwifery services now, and everyone feels that lot has been done and lots needs to be done in future to improve the quality of care. Keeping this in mind, government has introduced midwifery initiative in December 2018, and after the launch, lot of progress have been made. Even after the pandemic, we can see there is a strong zeal and intention of government of India and INC, Ministry of Health and Family, where towards even during the pandemic, to make progress in this particular front on midwifery initiative. So we are very much looking forward for the guidance from government of India. So this year's theme for Day of the Midwife is follow the data, invest in midwives. And with good reason, in the last years, a number of groundbreaking publications have come out using data to confirm what many of us already know, that midwives save lives and are a smart investment to ensure healthy, thriving mother and babies. Data can be used to better educate and support midwives and to better target our investment in them. So the theme is very useful, and we should focus on analyzing our data, not only the existing data, but also the past data, the data we collected through the past big programs. We need to analyze them, our past and the current approaches, which will help us in predicting the shape of the future and center it around the reality of midwives on the ground. As we all know, the programs I have mentioned earlier, the essential and central part of their success was nurse and nurse midwives. So I feel if we want the same success from the midwifery initiative, we need to invest in empowerment of the nurses and midwives by doing bold investment in health workforce planning, high quality training, MLCUs, in involvement of midwifery in midwifery and nurse midwife in the RMNCHA program, and their leadership, which will save lives, improve health, and strengthen the health system. As per State of Midwifery Report 2021, most of the RMNCHA, around 80 to 90% of the RMNCHA services can be improved by investing in midwifery cadre. I am confident that building a strong midwifery cadre and rolling out midwifery services will prioritize quality childbirth care to our mothers and their newborn, and play a leading role in achieving our SDG. As an organization, Maternity Foundation, our aim is to empower the nurse midwives through the digital health platforms such as Safe Delivery app. We all know that during the COVID-19 period, after a lot of face-to-face trainings, is not possible, and people are struggling to get the right information at the right time. So we advocate for the digital platform and digital literacy of the midwives and empower them with the life-saving protocols. Till date, we have reached to around 100,000 in-service and pre-service nurses, nurse midwives with the life-saving protocols through the Safe Delivery app, and we are committed to introduce and upgrade such tools in the coming year with continuous support of Maternal Health Division, Indian Nursing Council, and our strong partners. As this day is marked to recognize the contribution of midwives, I wish all the nurse midwives and those who support the midwifery initiative across world a great success. In India, midwifery initiative is going to be a game changer for the country, and we are very much looking forward to work under able guidance of the Ministry of Health and Family Welfare and Indian Nursing Council. Thanks a lot to Ministry of Health, Indian Nursing Council, UNFPA, JPIGO, TNAI, SOMI, USAID, UNICEF for their continuous support to this initiative. And we also congratulate all the organizers of this webinar for successfully conducting this webinar in the time of the crisis of the pandemic. Thank you so much.
Thank you, Dr. Tarun. I think we'll look more forward with you with the partnerships what we are going to have with the maternal health care in future, for especially on the e-learning modules and other virtual capacity building of our teachers.
Absolutely, ma'am. Thank you. Thank you so much.
I think we have some decline in the participants list now, but I'm going to take a few minutes for you. We'll close down very fast. I'll just take on NRTS, not a detailed one, just a 1 or 2, 3 slides on that. I think it was quite an interesting for all of you to have the Day of Midwife, where so many programs are being rolled out and so many supports are there from the stakeholders. As we said today morning, not only about invest in midwife, also have to follow the data. That was the main theme of this today's International Day of the Midwife. And for the data, we all have to work together for the data. It's not only Indian Nursing Council or the State Nursing Council can work independently. It has to be worked in tandem, togetherness. And why do we need this NRTS? It is in line with the SOAM report and the SOAN report, which President will be often speaking to you, and National Health Workforce Accounts. We are not done individually on our own, because it is somewhere in 2003 we started with a visionary president who said we should have a live census. So when we did a census in somewhere in 2003, we came to know only out of 100 nursing professionals, only 32 were the trained nursing professionals and other were untrained. So in that vision, why we require this NRTS? That is to have the scope of professional practice for nurses, as it will depend upon the availability of nurses and midwives with different preparations. National healthcare delivery systems, as you know, that we are going to have 86,000 MLCUs and levels of health facilities, types of health services to be provided, and expanded role to be played by the nurses. You know, we have around 28 state nursing councils now. With UT doesn't have the state nursing council, it's clubbed with the states whichever is close by to them, like Tamil Nadu and Pondicherry together, and Andaman and Nicobar Islands, whereas Kerala looks after the Lakshadweep, and Goa is independent now. Only northeastern state, only one of them, everybody is around. Nagaland has its own nursing council. So almost all states have their own nursing council. I'm sorry, the numbers are not seen. Anyway, the registered auxiliary nurse and midwife were around 5 lakh ANMs we have, and registered nurse and midwife we have 22 lakh nurses, and registered lady health visitor we have 50,000 lady health nurses. And what is the objective? As you said, we want a unique identification of each nurse and midwife. In our country with 138 gross population and have 50% of females. So we should have nurse and midwife. Okay, we can't afford to have only midwives, but yes, we are going to have a nurse practitioner midwifery. We are going to have a cadre of the NPMs now, because we want a specialization with them who will man the MLCUs. Develop online availability of data of active registered nurse and midwives across the country. Provide online management of registration application. I think we're going to have within a month or two about the NRTS, where you can download your records. NUID can be downloaded. For example, it takes time for 6 months for the reciprocal. Within 2 days, you can do the reciprocity. You'll get the reciprocal approval from the state nursing councils, and also the primary registration will be of ease. It will be done at the institution level, and the verification is done by the state nursing council. Remember that State Nursing Council its duty is to do the registration, not Indian Nursing Council. Indian Nursing Council is only giving the platform for them for the ease of movement of our nurses in our country, and to have a head count of each nurse and midwife. As you see, when I looked into the NRTS summary report, I could make out that we have 30 NPMs in a state of Gujarat, whereas we have 127 as per the information. But only 30 have enrolled in a record. So I request you all to enroll on your own. You don't need any money for enrollment. Yes, primary registration, it's a duty of the State Nursing Council. The information has to be provided by you, and you have to pay the amount for the requisite fees for the primary or reciprocal, whatever you request for. Right? As I said, it's Aadhaar enabled biometric verification, because we have observed that a midwife has around 2 to 3 registrations at times. I mean, you move from Kerala to Tamil Nadu, you move from Tamil Nadu to Delhi, you have all 3 RN and RM certificates with you, because in the state, they don't delete. They give you reciprocity, but they don't delete. But here we are not going to delete, but you are going to transfer your RN number from Kerala to Tamil Nadu to Delhi. So that is what it's called, transfer. So you are there as a one nurse in our country, nurse and midwife in our country. And that's why there's no non-duplication of nurse and midwife data. So we are not aware. The 22 lakhs, what I informed you about RN number, is we are not aware whether they have your number is thrice or twice or 10 times in the different registrars. So enable quick verification process by the hospital and private clinics before employment, because they also want to know the nurses. As I said, only 32% were the trained nurses, and the other 68% were untrained nurses. So for them, it's a quick verification process. We not give you all the details of nurse and midwives, but we'll say, yes, they are a registered nurse and midwives, and they are the trained nurse and midwife for the employment per se. And standard application form and procedures, because if you look into Sikkim, it has a different. If you look into Karnataka, it has a different application process. If you look into Uttar Pradesh, it has a different application process. So we have standardized the application form and procedures, and ensure quick primary and reciprocal registration. As you all know, we have 5 types of registration. NRT has developed almost everything except the temporary registration, but we need a cooperation of yours to have the data, because as in yesterday, the Prime Minister office had requested us for the information, but whatever we have in the NRTS, we have submitted them, but not all. That is a name and the mobile number for them to contact you in each district wherever you are. So we are not following tracking. A nurse tracking system doesn't mean I'm following a particular name. No, we're only following, if for example, in one district, how many nurses are available and how many health facilities are available. So how many nurses we need to deploy. So the one time button, just with the button, with one button, we'll come to know so much of information. But for that, you have to inform us. For example, today's webinar, we could have like for example, yes, Indian Nursing Council have an access to nursing institutions. We send you emails. We have your website here, so you all look into it. But the clinical nurses, we are not able to approach. For them, if they give us a correct email and correct mobile numbers in this NRTS platform, we are able to ask them to inform them, look, we have some program for you, please do come and attend. So that is what we want to approach. It is not the data is there for manpower planning. It's for in which district wise planning one can do. Like how much MLCs are there, how many nurse midwives you need to have. So how many NPMs we would like to have. So this is all policy decisions we can take through the data. That is why it requires data. The follow the data is important for the midwives today. So what's the outcome of this NRTL? It's computerized live register, right? You know, today because we have frequency of from 18 years to 60 years and above 65 years. So if you have a data, we know how many nurses are going to retire in next 2-3 years and how many we need to have more nurses. So today, what is the capacity of admission? So like this, we can have the manpower planning and simplified and uniform registration. So once it's a simplified one, and the uniformity is there throughout the country. So NUID and card and passbook you can download. Passbook you can't download. NUID card you can download. Passbook can be printed at the SNRC level for the primary registration. Effective manpower planning by policymakers, as I've already informed you, and quality education. You must say, what is the education related to? Yes, we do have nurses who are working and also studying, which is unethical. So we can come to know, and we'll also come to know how many teachers are working in a nursing institution, because people are showing themselves in 2 or 3 places. So we can just track them. So some, not all, some of us are doing some unethical practice. For that, we will have, no, you can't have this. And online quick verification by employment agencies and stakeholders. So appropriate management information system and digitally signed certificates. So you can download wherever you are, and you can get within 2 or 3 days, because we have our institution also to have a biometric device, such that you can always, wherever they go, they can always do the verification before applying to the state nursing councils. So thank you. That's all for me. Not much, but I just want to say the data is very, very important for everybody. So we have to ensure that there are no fake nurses in our community, because we are proud to be a nurse. We don't want any other person to come and say I am a nurse, because we have seen many biochemistry background. They have posed as a teacher, as a principal of schools of nursing. So thank you from my side. I think we have Dr. Kirti Iyengar with us, who's a national consultant, national program officer of UNFA. Madam, you want to do any remarks? Would you like to give any remarks today for our audience?
Thank you, Bharti. Actually, no, I think all the previous speakers have already highlighted all the importance of midwives, and I don't have any further remarks. Thank you.
Ashish Sharma, would you like to say some closing remarks? Would you like to have some closing remarks?
I was not able to hear everybody as I had been to hospital. First of all, I would like to wish all the nursing fraternity a very happy International Midwives Day. And I think I have heard about 3 speakers. Everybody talked so highly about the importance of the maternity care, which is really of great importance, especially to curb the maternal morbidity and the newborn mortality care, and strengthen the midwifery services, for which I think together so many government and non-government international organizations are involved in, which is highly appreciated by all of us, and we would like that continuously we be the active part. We take the active part, and be always ready to get involved and take the midwifery services to its maximum quality. And I wish everybody all the best for being prepared, and to be more prepared for providing the midwifery services. Thank you.
Thank you so much, ma'am. President sir, there is a question for you from Leela Worki. Creation of posts is essential also for the replacing existing or contractual positions. Looking forward for this.
This is a very good question, which I was making this issue since long time, especially in a health infrastructure. this issue of a contractual engagement of the nurses and midwives will have a lot of legal implications. So therefore, we are always making an effort to the state governments, and of late, I think you are getting some sort of, some shift in the policymakers at the state level. They are started creating the post. Still a long way is there, because you know that the health is a state subject, and now the government of India initially started this process of the engaging the consultants, which has percolated to the professionals. And these professionals cannot be a consultants, because many a times they are bound for the legal act and the legal commitments. So therefore, I think we have to continue to advocate that in a health professional, especially nursing and midwifery professionals, need to be a full-time, and also because the retention is going to be a very big challenge, because we have seen in we are investing more money for the training of the nursing and midwifery professionals. As and when they get the positions, so they are moving. So the retention, I think that's what in the 6th Pay Commission, when I was in the government of India, one of the mantra of the WHO was put to the through the TNA and the other professional like Mrs. Kurana, jointly put forth the idea to the Pay Commission that the attraction and retention is a big this thing. So if you want to retain them, you have to provide the reasonable working conditions. That's why I think I have to definitely I take pride in government of India is giving a respect and also the credibility for increasing the pay scales. The first month pay salary of the nurses who are appointed in the government of India, 65,000 is the first month pay packet. So this is where now the TNA went to the Supreme Court, and I think all the stakeholders has to, because at least the government of India, after the Supreme Court guideline, the TNA was the petitioner in that. So they have said they need to be given 25,000. If we see the status of the World Nursing Report, very categorically out of the 10 recommendations, which is very clearly not only for the nurses, for all the midwives, that they should have a career path, and also they should get a better working condition. I think in this perspective, we have to work a long way. All the professional nursing and midwifery professionals and the stakeholders have to work hard to convince the state governments to create the permanent position, so that they will be able to provide a qualitative the nursing and midwifery services to the rural and also in the community. So therefore, I think it's a long way, but we have to work together.
Thank you. We have one question to Dr. Tarun, again from Leela Varki. Thanks, Dr. Tarun. We still do not have a good midwifery MIS that is needed within MLCUs, and also for creating a midwives portfolio. Is the Maternity Foundation helping in this?
Thank you for the question, Bharti Madam. So right now, our focus, Maternity Foundation focus is more on creating the education part and the capacity building part for the midwives. So we are working on upgrading right now Safe Delivery app and one learning management system, which will help. Which will help in upgrading the capacities and knowledge of midwives in India. So we are trying to make one LMS, which definitely we are going to show you and let. So this is right now our take for the MIS. We need to think of if we want to collect the data. We need to think of it, and we need to go more in detail in this regard.
I think to answer the more on this question, our NRTS, Nursing Station Tracking System, is going to reflect where all the nurses are going to be there. I think if once the nurse practitioner, nurse midwifery practitioners their additional qualification is going to be registered as additional qualification. That means we know that how many nurse practitioners are there in each state. Once it is linked with the NRTS, we know that where the nurse practitioner is, midwifery is working, where she is moving. Even I think due to the shortage of time, I think Bharti could not go much about we know one of the issues which we are facing in India is, if we ask the question to Indian Nursing Council or to the Ministry of External Affairs or to the Ministry of Health and Family Welfare, how many nurses have gone abroad? We don't know the data. We don't know the data. Therefore, that is the reason the nurse registration tracking system is having a inbuilt component that a nurse goes to the UK or USA. She is going to log on to the Indian Nursing Council website. She is going to tell that I am staying here. And once she comes back, she will be able to get their license back in India, so that we know how many nurses are in abroad. So this is this is where I think that's what I'm telling you. This digital data. I think first of all, for effective now the SON report very clearly they have come out. They started with a report with the 5,50,000 nurses are shortfall. Now we have made an assessment. Within 5 years, how many people are going to retire? That's why they have added another the estimation. So therefore, this data is for effective manpower planning and also for the nurse midwifery. And definitely the NRTS is going to play an important role in capturing the data of where all the nurse midwifery practitioners are going to be working.
Yes, so we have a lot in NRTS, provided the active participation from nurse and midwives are required. Whenever they move, they can just upload wherever they are working, so that we can MIS, we can maintain, because the transfers are there also in the government organizations. So that also we can positions can be seen, so we can know, okay, how many professor level teachers we have, how many associate professors we have, and assistant professors, and how many clinical nurses. As Sir said, nurse practitioner midwifery and nurse practicing critical care. So whatever category report we can have, we can generate from this report. So I think we have many questions, but it's time now. We'll answer you. We'll save this chat box. Pearl, as a facilitator, would you like to comment anything on the virtual capacity building of midwives? Like to give the last comment before we close down today? So
I would just want to say one thing, everyone, that I think for what Mr. Dilukumar said, and we've been saying that I think we have lot of data already, whether it's this earlier the SWAN report and now the midwifery report, but we need to also strongly advocate with the not just the policymakers, but also with the politicians, who are very important. And I think we want to initiate that conversation also. But I would also urge, because you are the force which is there out there in the field, that you need to talk to your elected representatives also, and ensure that some of the things which are challenging, whether it's related to the salaries, whether it's related to filling the posts which are there already is, in the government system, but they are not being filled for a long time, and ensuring that some of the things that, a lot of things have been listed. So I think we'll have to go full force in making sure that we don't lose the steam which is there, and work with all stakeholders. And I think political leadership is very critical at this point in time. I'll stop here.
Dr. Sood, I think made a point that now we have two reports. One is SWAN report and SOMI report to be implemented in India. So this is a big task. The WHO and the other stakeholders have to work with the government of India to see that how these two reports can be implemented. So it's going to be a big task. So I think JAPAGO and the WHO is taking a lead of working out the strategy, how to ensure these reports are. And I think we had some brainstorm consultation with some of the experts and all. And those experts have given one solution. That solution is that, as Dr. Bulbul Sood was mentioning, that yes, there is a lot of administrative bureaucratic support is there for the nursing and midwifery professionals, but to take higher level, because there are so many reports like IPOR committee reports, so many reports have been coming to already justified what the nursing and midwifery profession is required to be supported. So therefore, the experts have given an opinion. Now, enough is enough. Please take higher level. The higher level is, I think, our experts also has given some indication that there is an institution of parliamentarian for the family planning. There is an institute is there in Delhi, which has been a lot of members are the member of parliaments. And at least Indian Nursing Council has seen at least we have 3 member of parliaments who are in our board of governors. So so therefore the experts are telling to the WHO and to the JAPAGO and to the Indian Nursing Council, why can't you take these 2 reports and give it to the institution of the parliamentarians, and they may work out the strategy of maybe they will be able to request them to develop a steering committee, and also with the latest the evidence where the nurses and midwives are working in COVID-19. Now there is a public, the visibility we are seeing among the eyes of the public. So the experts are telling this is the right time, take this message to the parliamentarians. That's how I think Dr. Bulbul Sood is taking the lead, and we are, the WHO has also had in the brainstorming session was there, and we have to work together to see that all the stakeholders, I think a lot of advocacy is required, lip sympathy is enough. I think there should be some action. For that action, I think this is the right time. India has got these 2 reports, and these 2 reports encompasses all the issues and problems which has been reflected in these 2 reports are very relevant, appropriate to Indian nursing and midwifery sector. I think that is one way forward, I think experts are thinking. The other latest information which the ICN, we had because of seeing the COVID-19 surge, and the whole world, I think, started sending messages and asking the ICN has given the international solidarity. They have expressed and they have made a statement, and that statement has sent to us, and we have put up in the INC website. And they are also more concerned what some support is required to be extended during this COVID-19. I think one of the issue which is coming up is, as we all know, that vaccine is very important. We have about 6 to 7 lakhs of the nursing students from the first year to the final year. I think they need to be vaccinated. We know there is a big challenge. Government is committed to provide the vaccination to everybody. But I think the international solidarity and the professional associations, how we can work together to strengthen the government hand to see that this can be ensured, or at least our front level nursing students are now the government of India. We also put up the proposal to the ministry, and our proposal has been accepted for enrolling the final year nursing students for the COVID-19. So in this perspective, we are getting a international support and solidarity, and how best we can help them, because the British Indian Nurses Association, BINA, is one of the association is after me, because they're all very concerned. And especially our Annette Kennedy, the ICN president, was making his remarks in one of the webinar, where she was telling you many of the Indian nurses are working in our country, providing the very essential services in this COVID-19. There are different countries. So they're all now looking for the India, because they're all worried how our Indian nurses might be facing this challenge. So they would like to have some sort of international solidarity. I think we all have to work together, and any suggestions, I am requesting all the people in this context, any suggestion, comments, you are welcome so that we can take forward.
Thank you very much, sir. Dr. Argentina Mathur, would you like to give any last comment for a...
Thank you very much. Not really, just a big thank you for, the time dedicated to together analyze and look through the recommendations of the report. And as Dr. Dilip says, we now have enough data, evidence, reports. It's now time to operationalize, give it to the policymakers, make sure that it makes, it gets to that level of operations. That's our challenge altogether, to make sure that our advocacy efforts are focused on making this a reality. We know what is needed. We have the numbers. It's time to act now. Thank you to all, and for having me also as a partner. Thank you very much.
Thank you very much, ma'am. So I think we'll close the session. Thank you all speakers to take out your time in this busy schedule. And I think it's very short time also. But however, I want to say the last word is Government of India and Indian Nursing Council and other stakeholders all working for the midwife, including for the data and for the curriculum and for the rollout of the midwifery program. So I think wish you all the best, and once again wish you a very happy International Day of Midwife. Thank you. Namaste for today's, and hope we'll meet again on the International Day of Nursing.
Thank you so much. Thank you so much.
Thank you. Thank you.
Thank you, everyone. Stay safe.
Thank you. Thank you.
Thanks.
Thank you.